Hi, uh, good afternoon, and everyone. Sorry for the delay because we've been in the practice session. We were facing some technical issues. Okay, so we'll proceed to the session. So, welcome you all for today's IPC free webinar. And today we'll be focusing on managing staff exposure, needle sticks, TB, and infectious diseases. So we have a guest speaker for it. So I'll be introducing her in next another 2 minutes. So before that, I would like to take you all to the quick introduction about Skills for Med. So we have been established since the year 2018 and committed to providing comprehensive training program to enhance the capabilities of the healthcare professionals. And we have 30,000 plus healthcare professionals who have got upskilled through us, and we have 1,000 plus hospitals who have networked with us, and 50 plus course topics have been launched so far. And also with this 30,000 healthcare professionals, we're not limiting to it. We welcome you all who are yet to join our WhatsApp community and be a part of our learning community and become a professional healthcare professional who enhance the skill, build confidence, and transform your patient care at your healthcare organization. So, and for all the for the newcomers who have joined for this IPC webinar, I would like to take you all what is actually the Skills for Med logo speaks about. So it has 4 stages, as you all see here. The stage 1, which is about service excellence skills, where, for example, we focus on infection prevention and control basic, and about the communication, professionalism, all the survival courses which is meant for the health to run the healthcare journey in a successful manner. And the stage 2, it is about core patient centric skills, where we actually focus on transforming the healthcare professional from the competency level to the clinical expert level. So in level 3, it's about specialization skill. Choose your specialty. Already you're in a specialty, or you're in a step ahead to choose your specialty. For example, ER upskilling program, labor room upskilling program, clinical instructor program, and also we have infection control nurse course program and infection prevention and control program. So all these courses are coming under this specialty. And next, after completing all this stage 3, it's look forward for your stage 4, which is about leadership skills. So where we have, 2 kind of courses. One is healthcare management course and one is leadership management course. So this is all about the, Skills for Med learning pyramid. Yes. So I have this quick announcement about upcoming quality masterclass. This is on next week, which is on Wednesday, 25th February from 3 p.m. to 4:30 p.m. It's a paid masterclass. You will have a real worth feel of paying towards this quality program. It is given at the offer price of $799. A lot of registrations are coming for this program. Already the seats are filled, but still we thought of extending the seat for a lot more participants to get benefit out of this, out of this prestigious speaker. So who is like Dr. Shalini, who is head quality and patient safety Fortis Hospital from Mulund, and she is an active member of CAHO, and she have did a lot of programs related to this quality. And this is going to be a life-changing moment. After attending this program, you will master the quality aspects when it comes to NAB, JCA, and ISO accreditation. And of course, you will be excellent in internal audits. You will face that in a confident way, and your view of or the perception towards the auditing, it entirely changed. You will look in aspects of surveyor, how it mentioned in the title. So this is the QR code. You can scan this QR code and register for this program. And towards the end of the program, during the Q&A session, do not worry, I'll bring up this flyer again for you all to register for this program. Grab this opportunity and register yourself and become one of the surveyors out of this session. So to know more details about our courses, you can contact Ms. Jayanti. She is our admin manager, and number is on the display. And also you can visit our website, which is displayed over here. Yes. So today, this topic, our APC free webinar will be dealt by Ms. Namita Barik. She is a senior practitioner in infection prevention and control, and she's working in Apollo Indoor Hospital. With over 15 years of experience, she completed her nursing education at Apollo College of Nursing, New Delhi in 2009, and has worked in various roles including emergency department, infection control nurse, and infection control coordinator across Apollo hospitals in Delhi, Ahmedabad, and Indore. She has experience working with NABH and JC accredited hospitals, holds certifications in infection prevention control from national and international organizations. She also been involved in state level initiatives related to antibiotic policy and received state level recognition for her work during COVID management. She recently presented a paper at the NABH conference in September 2025, New Delhi, and won a prize for her presentation on the use of correct techniques of safety devices to prevent accident and inoculation injuries. This shows her, a strong base in academic towards this infection prevention and control. And we are glad to have you here. Welcome you, and we are looking forward for your session on about this topic which you're going to cover. We are eagerly waiting for you. Over to you, Ms. Namita.
Very good afternoon, and thanks, Stella, for the introduction. Felt very nice. And I welcome you all for this ICN webinar. Am I audible?
Yes, of course.
So sorry for the technical interrupt. My video is gone, so I will be just sharing it. So this Medful, I like this Medful skill learning program, which is a very good platform for the nurses and all the medical fraternity to gain knowledge and learn about it. So today's webinar will be only about the discussion related to the practical experience which we have gone through. We know already we have all worked in JCI and NABH hospitals. So protocols and what are the policies are there. But whenever there is a which we fail to do it. So our session will be only based on the practical experience which we have gone through from the starting till the end. So I'll be just sharing with the slide. By the time we can go ahead with the pool test.
Sure, I'll launch the poll now. Sure.
Yeah.
You can pull up the presentation meanwhile. So, dear all participants, I have launched the poll now. I request all the participants to actively, jump into this poll and quickly answer to all these 5 questions. Thank you so much. So we'll give you 3 minutes of time to complete this poll. Thank you. Thank you for start answering for this. So you have 2 minutes, 30 seconds left. So you have 1 more minute left. I guess we have an enthusiastic participants today. So I could see a lot of participants actively involving in this poll activity. Thank you so much. And we have 30 seconds left. Thanks for all your hearts. 15 seconds left. Yes, so we have come to an end. I'm going to end this poll. I'm going to share this result. Yes, over to you, Ms. Namita.
Okay. Like the first question was managing staff. How have you ever come across any incident in life or exposure in a hospital? So I think 63% of you have been reported to incident or in your daily life have come across with an accident. So whenever any accidents are there, what was the first question which came into your mind? Uh, So maybe whenever there is an exposure or whenever there is an accident nearby, so there is always a risk. And whenever we ask what happened, so they will not accept anything. They will say that something went wrong. Something went wrong in a sense. If incidents is a road traffic accident, you met with an accident. But then if you ask somebody how you met with an accident, there was a cow coming in front of me, and so I hit my bike. So we never accept that the mistake has happened from my side. So so same way, whenever any incidents are happening in the hospital, also the first question which I ask, the first answer which I get is almost a sorry. The sorry doesn't realize that what kind of mistake is there and what seriousness it can happen. So I think 60% of you have already met with accident or exposure in the hospital. The second is, have you ever managed a potential exposure or infectious disease in the hospital? Same, it's also related to the accident routine life. Whenever we saw anything in roadside also, we just we try to help the person, we try to help the victim. So in the same case, whenever we are in the hospital settings and we come across in any of the exposures, we try to help, we try to find a root cause, we try to set up preventive measures. So I think 80%, 82% of you are able to manage exposures very good. So the best example can be of the COVID. Like we have fought COVID, and what the result we are actually seeing it now. The third was the how confident are you in following SOPs and procedure. This is like 62% of them have done. Right. So we are all working in JCI and NAPS hospitals. Most of the hospitals are now been aggregated. So aggregation is based related to our SOPs and protocols. Even though number of trainings we have gone through, number of audits we have gone through. But at times we just fail to follow our SOPs, which leads to accidents and exposures. Then how confident are you in handling infectious exposures? That means 55%, very good answer. And the last question is, so you are hoping for preventive strategies, I think, right? So this is how the pretest was put. So I'm just happy to know that 80% of the audience are being uh, known to about the managing of exposure and what does it mean. So coming to the topic, that is managing staff exposure and needle stick injury, TB, and infectious disease. So, as an ICN, as an infection control worker, as an infection control practitioner, what first comes into your mind when you enter into a hospital? So, whenever we are entering into a hospital, there is a fear inside us, that hospital. So we have all gone through the COVID era. During the COVID era, whenever the term hospitals comes, everybody was very scared. And that time also, we used to whenever we used to get a call from our house, only our parents will ask one thing: Are you okay? Are you safe? Like, so, being an infection control practitioner or being in the infection control department, our first motive of duty is to safeguard ourselves first and work for the and safety. Safety depends on the safety of ourselves first, safety of the patient for whom we are caring, and safety for all of us whosoever is entering in our hospital. So, it's all related to safety and safety. So whenever infection control term is coming, any infection control audit is coming, the term HIC is coming. So there is one thing only which comes into the mind is 5 movements and the sixth step. In the moment, I like the third movement, that is whenever you are coming in contact with any of the body food exposure risk. The risk word is very important because it identifies that you are putting your life into risk for managing the patient, managing the hospital, managing the staff and everybody. So whenever you are putting your life into risk, you are the first one to safeguard yourself first, and then you should lead everything. So as soon as you enter into the hospital, you should treat everything as infectious, whether you're coming in direct contact or whether you're coming in indirect contact. So whenever you enter into the hospital, you should treat everything as infectious, and you should be always be with your gaze, and you should be always protecting yourself first. Then only you will be able to manage exposure. Then only you will be able to manage the infectious disease. So as Stella has introduced me, I am Namita. I'm working as infection control practitioner in Apollo Hospital, Indore. So I'm one of your colleagues who is there. So I'm very happy to share my views on this platform and gain some knowledge. I'm also here to gain some knowledge. It's not only about getting knowledge; it's also gaining knowledge. So this is the picture which I always like, and in the medical learning, I'm fond of Dr. Pari, who always talks about a safety culture. Culture means like we all follow our religious belief, we all follow our religious culture, right? So since beginning, we are in that frame, and still now we are following. For example, that during my childhood, my mother told whenever you are entering into a church, you should always be putting the scarf. So she told me for the one time, and now whenever I'm going to a church, I'm just putting my scarf on. So it's not that my mother every time tells me that you are entering into a church, so you should wear the scarf. So same way, whenever we are in the uh, field, so we should always be ready. It's not always like something is coming, somebody is saying, then only we should follow the SOP, and then only we should follow the protocol. So you can see some of the pictures I have put. This picture is from the film Bahubali, which I always like. Like he was knowing that somebody is going to attack his kingdom, but he was not prepared. But although he fought because he was already prepared, he was known that that something will be happening, and he was already ready to defend that. This is like fire, like any time that incidents can happen. So fires are always like we call them, and they rescue us. And this is like our most probably our soldiers who are always ready in the field. Nobody knows where they will be getting, and they are always ready to save us. So it's like a safety culture means we should always develop a safety culture in our day-to-day life also, not only in hospital but also in a personal life, that whatever things we are learning, we should always be putting into in practical scenario. Like whatever SOPs and whatever standards are there, we should be following it religiously, not only when somebody is watching or not only when somebody is telling. Simple example can be like whenever we enter into the hospital, if somebody sees the ICM, they start washing their hands. If they start seeing the infection control department, any of the staff, they start putting the mask on. So it should not be like that. If you are seeing somebody, you should be wearing your gas, you should be following the protocols. It should be every time. Apart from that, whenever there is a question, like in the starting, I said whenever I found a staff being not following the protocol or procedure, the first answer which I get is sorry, which is a very cute answer. And it's always like I was about to follow it, but because of this, I didn't follow it. Sometimes it happens that whenever there is a like junior staff is there, so they are hesitate to tell us that what has happened. So it should not be like, we should not be having a fear of telling what we have done wrong. It's always the acceptance part. If you accept, the RCA and kappa will be well defined. So sometimes there is a lack of psychological safety, which we should always assure the staff that there's nothing harm in reporting any incident. There's nothing harm in reporting any of the exposure. It's only for the betterment of the staff. So we should always speaking the what has went wrong. Then we should always be like, as I told, that we should always be developing a safety culture, which always defines that if one or two things are watching, the implementation part can be covered up very well. So it's only about the culture. It's whatever things we are doing, it's only about the protocol and policies which we need to follow 100%. We should always try to follow it 100%. Any deviation from the policy, any deviation from the protocol definitely leads to incidents or exposures. So today's take-home message from this topic will be proactiveness, exposure management. That is, managing exposure requires a proactive, systemic approach which prompts incident response and risk assessment. Proactive means there are near miss also happening. So we should always, we should not neglect the near miss. We should always act on it so that the major incidents can be preventable. Preventive controls like preventive lies like engineering control, administrative measure, and personal protective equipment to ensure safety. Like as we know that in in most of the hospital now, they are in advanced technology. They are using the advanced equipments. But if the pilot is not good, then there is no use of that advanced technology. So there should be always the control system which we are having in the hospital. It should be well versed with the staff so that they can be well utilize that. And again, training is always like very important. Previously, it was like only lectures. Now the module of the training modification has been done, which shows very interesting way of teaching also. So now the digitalization has been done. So rather than lecture based, we should always go for the practical based and train staff. That continuous improvement and monitoring, which as I told that we have undergone so many audits, we have undergone so many things. Then also we have come across some of the findings. So for the continuous improvement, you should always going audits and do the facility. For every incident, whether it's the exposure or whether it's an incident. So it's not only about infection control. Whatever incidents is happening in the hospital, you should always ask question like why it happened, where did it happen, who was involved, and what went wrong because of which the incident has happened. So that you can come across proper RCA and then you can have a proper corrective and preventive measures. For example, what exactly happened? You can describe the mechanism of the injury. For example, if any needle-stick injury is there in my place, I always ask the staff to narrate and write it on in a paper so that I can step by step check where he or she has gone wrong. So second is, where is the injury occur? Injury can be a location, like our hospitals are divided into high risk areas and low risk area. So the location is very important, whether the incident happened in a high risk area where the procedure was more, or in a low risk area where the procedure was less. So third is like, when did it occur? It happened during the daytime. It happened during the peak hours where there was more patient, where there was more OPD timings, like, and time of incident, like at what time it happened during the day, it happened during the night, or it happened during any of the peak hours. Then who was involved? Who was involved means who was the health worker who was involved? Like whether the health workers was a new staff or it was an old staff, or whether he was trained, or whether he was knowing the protocol, whether he was a new induction one. So who was involved means category of the staff should be known. Then why? Why means why did the incident happen? Whether he followed the protocol, whether he followed the policy, whether he has undergone training or not. So these are the questions you should always ask whenever any incidents are happening in your any of the areas, so that you can come across for a proper RCA and CAPA. Apart from that, you can have the leadership involvement in that, so that it can be discussed and proper corrective and preventive action can be taken. Now coming to the exposures, like as I told, everybody is like riding a vehicle, whether it is two-wheeler or whether it is a four-wheeler. So whenever we are riding a vehicle, we always are at risk. Risk in a sense that first time we have been taught that you should be always wearing a helmet, you should always be wearing a seat belt. But it's not always applicable that whenever you are wearing a seat belt or whenever you are having a helmet also, you will not met in with an accident. But the exposure injury, if you're wearing a helmet, the exposure of injury will be less. So it's always like whenever you are in the exposure. So what is the exposure? Depending on the criteria of the exposure, you should define it. So it's not always, you should always be wearing a protective gear, as I have told. So any exposure in the hospital which is related to the breach in the protocol is termed as a staff exposure. Like any staff who has been exposed in job-related contact with any potential infectious source such as patient, co-worker, contaminated material, or the environment that could transmit infectious pathogens to the worker. Like in the beginning, I told, whenever you are entering into the hospital, you should treat everything as an infection, because everything is coming in contact with directly or indirectly to the patient. So in case if any of things are related to this and you find your thing to be infectious, so it comes into the staff infectious category. So how you will manage the staff exposure in healthcare? The first is that you have to define the type of exposure, like whether it was a needle stick, it was a body fluid exposure, it was a percutaneous exposure, it was related to the skin, or it was related to the bloodborne, airborne, droplet, or what kind of exposure was it. So after an exposure, you should always have an immediate action, that is depending on the type of exposure, what exposure you have got. So the cleaning part is very important. The reporting part is very important. The identification of the patient and the source is very important. After that, the follow-up medical evaluation is very important. So whenever there is an incident, you should always report it on immediate basis, so that you can have a proper follow-up. That preventive means, like, you should always be having your prevention before. Prevention is always better than cure. So for the prevention, if you should always be wearing your safety devices like PPE, follow safety devices matters, follow protocols, and practice hand hygiene, not have right. So mode of transmission, as I earlier told, whatever the infection or exposure is there. So whenever there is a breach in any of the protocol, like you are following universal protocol, universal means is your hand hygiene. And if I ask that since when you are doing hand hygiene, the one answer which we get is like, since beginning we are doing. Since beginning when my mother taught me to do hand hygiene, right? So my mother also taught me hand hygiene, but still, whenever there is an infection control session, we are always like talking about hand hygiene. So when I was a kid, I used to do the hand hygiene, but when I came into the hospital, I came in join infection control department. Then I came to that, array, there is a guideline which shows that you have to follow the 5 movements, and there is a 6 step that you have to follow to protect your hands. That is only 90% infection can be controlled. So universal means whatever protocol you have to follow all over the hospital, that is your universal precaution, and that is your hand hygiene. Standard precautions means you have to mandatory follow it. Like for example, you cannot enter a OT or you cannot enter a cath lab without wearing your scrub. So it's the standard protocol that you have to follow, that standard guidelines which has been dedicated to that department. Contact means you should always be, wherever you are coming in contact with any of the body fluid exposure, whether it is secretion, whether it is blood, or whether it is any of the body fluid which is coming from the patient, you have to follow the contact precautions. Then respiratory airborne and droplet precaution. Respiratory airborne and droplet means whenever there is a air, like, so for example, if I get, now the season is winter. So if I get a cold cough, patient with a cold cough. So if I go and go with hands with the gloves, so there is no use. I know that patient is coughing, so I should always be wearing mask, which is very important. So as a practitioner, as a staff, you should be always be knowing that what PPE is applicable for what procedure. So you should be able to identify the type of PPE also, that what PPE is required for what precautions, which is very important. So if you're not wearing, there can be a direct contact infection, that there can be a droplet transmission infection, there can be a vector-borne transmission, or direct or indirect from any of the object infection. Now, what is staff exposure? As I told you, we are always negligent. Like few of the times, it happens when I ask staff. Abhi to, matlab, this is only the first time I have done it. This is the first time which it has been happened. So the severity of injury, we should always be explaining that why we are doing it. Like, so once like bloodborne viruses enter into your body, we will be only doing follow-up for 6 months. And if anything turned to be positive, that has to be taken care of to the lifetime. So that instance of explanation should be given to staff, so that they are well versed with what they are doing, and they should be properly following. Like whenever there is an exposure related to bloodborne viruses, like if there is a bloodborne virus exposure, it's basically related to the needle stick or blood and body fluid exposure. If you're coming in that category, then definitely there can be like HIV, HBsAg, and HCV, you can transmit. Contact means whenever you are coming in contact with any of the contaminated things, like medical devices or equipment, that can lead to MRS or C difficile organism. Like if you're not washing hands, a patient is having frequent loose motion, so definitely you will be transmitting C difficile, right? For example, I was not from Indore, but when I came to Indore, I found people eating, this city is fond of food. So I went to the one of the stalls after my duty hours. I had a pani puri, and 8 o'clock in the evening, my stomach got gurgur. So this is how the transmission happens. Like if we are not indirectly or directly coming in contact, so there can be a transmission. Airborne, like airborne droplet and respiratory precaution, that we have already gone through, and we have seen the COVID era. So that time also I got to know that few of the staff, they told me, ma'am, I have followed all the precaution, I have followed all the PPEs, I have worn all the PPEs, not a single part of my body was exposed, but still I got COVID. It was just because maybe sometimes they might have lapsed it where they have not. And one of the example which I can also give is like, for example, now we are in the eradication of TB. TB also a part of this infectious disease. So if somebody asked me to isolate a TB positive, so I talked to the consultant. He said like COVID, now TB is also in the environment. So how long you will, how many patients you will be isolating? So it's not about isolation. It's always about precautions. Like if you follow the proper precaution, and with the proper technique, there should not be any, there should not, you will not be landing up into any of the exposures. Then how do you identify the exposure? Exposure means like needle stick injury, sharp injuries, it's always like with device associated. Contact without PPE, like we are like, if I'm having cough, I'm wearing a mask and you are not wearing a mask. So it's like without PPE. So aerosol generating procedure, like, patient is having a respiratory problem, patient is having a respiratory disease. So during that time, if you're not wearing your N95 mask, you're not wearing your mask properly, then time you can expose to aerosol procedure or airborne infection. Breach in isolation of protocol. Like isolation are of two types, like positive pressure isolation and negative pressure isolation. So in either of the case, if you are not following the procedure, if you're not following the proper donning and doffing, definitely you will be landing into exposures. Like contact without PPE, I have just shown the picture also here. Here, if you're not washing the hands, which is very important, you will be landing up into exposure. Aerosol generating procedure, like if I'm having a cold, cough, sneezing, if I not follow the coughing and coughing etiquettes, definitely I'll be generating a droplet and it can cause infection. The breach in the isolation and PPE protocols. So if you're not following your barrier precautions properly, you will be definitely leading to any of the disease exposures. And the most important, very dangerous is our needle stick injury, because it's always related to body fluid exposures, and it's whenever it is there, so it can lead to your bloodborne viruses. Now, this was the small introduction about just how the exposures are there. So for every exposure, what is important is to follow your universal precaution, your contact precaution, your respiratory precaution, your airborne precaution, and droplet precaution. So any breach in any of the protocol following precaution, you will be landing into this infectious disease exposure. Infectious disease exposure, which we have the topic, which is needle stick injury, your TB exposure, or any of the infectious disease which is there in the hospital. So if we talk about needle stick injury, we have done the pool test. So 80%, I think 60% of you have undergone incident in your lifetime. The most common cause is like recapping of the needle. We are in a habit of recapping, but still we know that sometimes we know that we should not recap, but still we do it. So it's all about practice. So what is needle stick injury? It's a wound caused by needle or sharp medical instrument accidentally puncturing into the skin. Now, the word accidentally is used. Sometimes whatever the incidents are happening, it's an accidental inoculation injury. We are not doing it purposely, but it is happening accidentally. And why does it this accidents happens? You must be very well knowing it. For example, it's not about accident in the hospital. Any accident in your life, you can say it's like, for example, if my duty shift it's 8 o'clock and I'm getting up at 7:45. So definitely I'll be in a hurry. I'll be waiting date. I will be crossing the traffic and I'll be having a challan cut. So this is how the incidents happen. So whenever there is a needle stick injury there, these are the things which happens. Like we are in a hurry. We know the protocol, but sometimes we fail to follow it and we land up into this incidents. So occupational risk for healthcare workers are very high, which is related to NSI risk. Exposing its risk is very high because it's always related to the bloodborne viruses like hepatitis B, hepatitis C, and HIV. You have vaccine for hepatitis B and hepatitis C, but there is no vaccine related to HIV. So it's very important that whenever you are dealing with any of the staff, you should always have your mind open and we should not be getting any of the negligency to have needle stick injuries in your future. So how does this happen? Like unsafe needle practices lead to increased injury risk in healthcare. Like this is the most common cause which I have found that whenever any needle stick injury is happening. So in that also, the first reason is recapping of the needle after is an accident. And means whenever we are any procedure, you just recap your needle. We know that we should not be recapping it, but it's a habit that we have recap the needle. So whenever I ask, why did you recap? Sorry, ma'am, I forgot to discard, so I recap. So second is improper sharp disposal, such as leaving needles on the tray. So one of our staff, what did she did is she did the medicine. There was a shop container nearby the bedside, but she failed to discard that. And she thought that after all my work, I will be discarding it. One of her colleague came and just below the file was kept, and he got the prick because the needle was not immediately discarded into the shop. Then high pressure work situation that causes lapse in safety protocol. That one of the incidents it happened that one of our colleagues, she wanted to go for her friend's marriage, but the in charge, she refused that no, you cannot go because there is less patients are high and you have to work. So we allowed her to go because even though she was present in the duty, she would have landed up into something very serious. It would have. So it's not only about protocols and procedure. Sometimes it's like your personal intentions also. You're occupied with work, which leads to incidents. And last, inadequate training and staff fatigue, particularly during the night shift. So inadequate training doesn't mean, for example, most of the we get during the ICN round, we get this comment that ICNs, they come, they speak, and they go. It's not only about that. Whatever you speak, the training should be effective so that the people should know the effectiveness and they should follow it very religiously. It's not that in the starting, as I told, that it's only about a safety culture. It's not only when ICN is coming, you have to follow. Whenever there is an audit, you should follow, or whenever there is anything that is very serious, you should follow. You should always follow the protocols and procedure to avoid such incidents. So these are the picture like I have shown, like improper disposal. Like as per the mandatory guidance, as per the state policy, you should always following the biomedical waste safety protocols. Sometimes, like as I told, that a staff was occupied with something else, or the patient, there was a movement that lead to needle stick injury. Safe handling, as I have mentioned in the beginning, that you have the best safety measures, you have the best safety devices, but if you don't know how to operate it, it is of no use. Then the most important thing is this needles recapping of the needle. How many of you still follow recapping of the needle? I think most of us, we follow, even though we are knowing it, but it's a habit. So continue habits. If you want to improve, there is always a scope of improvement. So whenever there is an exposure, what is the first step you should do it? First of all, you should not be panic. You should not squeak, and you should not suck. The immediate action, what you have to do is you have to only wash the hand with wound with the running water. You have to just inform your area supervisor or senior person who is there in the department, and immediately you have to report to emergency. I have written it emergency because 24 into 7 the emergency in the hospital works. For instance, you call your supervisor, she is on something else, she cannot pick up the phone. You call an ICN who is infection control in charge, she doesn't pick the phone. So it's better that whenever any incidents are happening, you should always, step one is like you should not be panic, you should not squeeze, you should not serve. You should only do three things. That is, you should wash the affected area under the running water. You should inform your senior, and directly you should go and report to emergency. After, when you have been counseled, you have been relaxed, you should inform to all the other stakeholders. I hope I'm not going too fast. Is it okay?
Yeah, please go ahead.
Then testing and documentation is very important. Like as in the previously, I have told you that whenever any incident are happening, you should always ask the person to narrate it so that you can come across what went wrong. So conduct a source patient exposed worker testing blood. First of all, whenever you are reporting into an incident in the ER, you should always knowing the source of infection. whether the source was positive or whether the source was negative or whether there was an unknown source. So conducting source patient exposure work with testing for bloodborne infections is completely, you should be getting it in detail. If the sources, for instance, if the source came to be positive, so should always know the viral marker according to the which your treatment regimen is decided. So it's very important that you should identify the source from where you have got the exposure. For the institutional safety and culture, you should have a clear non-reporting protocols to ensure injury reporting and enable preventive strategy. Like I always told that there is nothing to hide. It's always for the improvement purpose. So you should never underreport an incident whenever it is happening. So most of the hospital I have not put it in detail. So whenever there is an exposure injury or accidental inoculation injury related to needle stick injury or blood and body fluid exposure, the proper guideline is based on related to the NACO guidelines, which is a National AIDS Control Program. So based on that program and the exposure of injury, depending upon the hospital policy, like few of the hospital they have physicians, few of the hospital they have an ID consultants. So depending upon the exposure injury and depending upon the consultant regimen, there is a PEP, post-exposure prophylaxis required. The post-exposure prophylaxis is should be given within 2 hours or not beyond the 72 hours of exposure using antiviral drug therapy for 28 days. So it depends upon the type of exposure, whether it's what the superficial exposure, whether it was a moderate exposure, or whether it was a deep exposure. So based on your exposure criteria and based upon your physician and your ID consultants, the drug regimen is been defined. So according to that, the drug should, if the source is positive, so it should be given within 2 hours of the exposure. It should not exceed beyond 72 hours. For hepatitis B management, like during the induction, whenever any staff is joining, you should always, if a staff is not got the vaccination, you should always go for the vaccination, that is hepatitis B vaccination. As per the guideline, you should always go for 0, 1, and 6 dose. After the third dose is completed, 45 days, after the 45 days, you should go for the titer value. So you should always check whether the exposed staff is vaccinated against hepatitis B or not. If he is exposed against hepatitis B, so during the time of exposure, you should go for the titer value. If the titer value is less than 10, he or she should be given a booster dose as per the consultant or ID consultant recommendation. So management of the vaccination is our one of the infection control responsibility, that all the staff working in with clinicals who are coming in direct contact with the patient should be vaccinated against hepatitis B vaccination. Apart from that hepatitis B vaccination, whenever the is completed, you should always, after 45 days, the titer of the staff should be done. Post follow-up testing and monitoring. It's very difficult to call staff to come for a follow-up. We have to give frequent reminders that your follow-up is pending, come, 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 come. So the staff should understand it's not only a part of reporting, it's also a part of their health, their security, and their safety. So it should, whenever there is a exposure, the staff should be explained very well that why you have been called up, why this reporting is important, and what precaution you need to take after the exposure. So post follow-up testing and monitoring is very important. So regular follow-up testing for HIV, HBsAg, and HCV at least 6 months. 3 months, the regime for guideline depends on the hospital to hospital policy. Some follow on 0 days, 3 weeks, 3 months, and 6 months. Some follow directly like 0 days, 3 months, and 6 months. So it depends upon the NIPU guideline and as per your staff exposure policy. So counseling and support is very important. Whether whichever staff is being exposed, the counseling of the staff is very important, because maybe the staff can go into depression, or as he or me required a psychological support. So psychology counsel is very important role whenever any staff is exposed to any of the incident. So you should always have a psychological counselor or a second victim counselor. The second victim is the first victim is the patient, and the second victim is the staff who has committed the mistake or who has undergone the incident. So the staff must be in anxiety, he must be stressed, he or she must be afraid, like I have committed mistake, which I should not repeat. So the counseling is very important. The counseling is also very important, and follow-up is also very important, because you never ask the patient report. You never call the patient whether you turn to be positive after 6 months or whether you turn to be negative after 6 months. So there was an incident which happened. There was a patient who came with an acute MI. During the MI, he underwent an angiography. For the angiography, there were all the viral markers was done. So at that time, the viral markers turned to be negative. The patient was advised for a tipple vessel disease, and he was advised for a CABG. But that time, the family did not support it, and the patient was not in a mood of going to for a surgery. But again, after 3 months, the patient had the same symptom, and he reported, and they decided to go for a CABG. So when the patient underwent a CABG and that time the viral markers were done, she turned to be an HIV positive. So that means what happened? The patient was in the incubation period. So this is why the 6 month follow up is very important. We always ask staff to come and report. We always do the follow up of the staff for 6 months, but we never ask patient whether he turned to be positive or whether he turned to be negative. So whenever we are calling any of the staff, it is our responsibility to get the follow up done on proper time and proper period. Apart from that, the counseling is very important, that why they have been called, what has been happened, and why, if they are not reporting, what can be the consequences after that. So I have not put in detail the NACO guideline. Here you can see the picture. So as per the hospital policy, as per the ID consultant, the treatment regimen is given. So report exposure immediately. Like you should not be waiting for your in charge to that you call her in charge, and she did not pick up phone, and you should wait that I should inform her, and then I should report in here, or then I should report the incident. It is immediately you have to report the incident to the emergency department. After that, the testing is very important. So you all the depend on the hospital policy. You have to go for the viral marker testing apart from including your titer. So risk assessment is very important. Like as I told, depending on the risk of exposure, whether it was low, whether it was medium, whether it was high. So after that, if the source was positive or negative, if source is positive, within 2 hours the prophylaxis should be given. Second, if depending on the staff exposure and viral load of the patient, the 2 drug and 3 drug regimen of HIV exposure regimen should be started. For hepatitis B and hepatitis C, again, the staff status of vaccination should be known, and the titer value of the staff should be known. And after that, if the victim is known case of like other disease symptoms, like he's alcoholic, he is having any renal failure, or he is having any liver failure, that should also be taken care of before starting the drug regimen. So it's always like better, prevention is better than cure. So always P is, as I always, before starting, you should always be wearing your gear. So if you are not wearing, then this can happen. So what are the preventive strategies you should always follow? That, like I said, that most of the needle stick injury happens while recapping. So you should always avoid recapping of the needle. And even instant, if you want to recap, you should always follow this one scoop method technique of recapping needle. So, like we in every needle stick injury, this is the point which we discuss is about the recapping of the needle, recapping of the needle. But still, if we go for rounds, we find one of the two staff who will be recapping the needle. So it's all about practice. So practice, practice, practice. And if either you want to recap a needle, you should always go for the one scoop method technique. Then safety devices. As I told that even in the best institution, you are having the best safety devices, but if you are not able to use it, there is no use of that device. So regular training, whichever safety devices you are using, you should always be using it frequently so that the correct technique of use is applicable, and you should not be manipulating it, and you should not be getting any incident because of that safety devices. Again, safety precautions, like whenever there is my exam time, when I was a student and when my practical exam was there, so we always make sure that we always carry a tray. We always make sure that whatever, as per the protocol, whatever procedure has been given to me, the articles have been set. But as soon as we go on getting experience, the number of articles become less, and the method and technique becomes less. Like for example, previously when starting, we used to we used to get a scolding from our teachers. Why did you carry a tray? Why did you carry a tray? But now also, it's sometimes it's happened. We just take a syringe, we take a needle, we take a ampoule, and we just go and give injection. So practice is very important. The precautions follow is very important. Stay, especially like wearing gloves, protective during the procedure. So whatever procedure is defined, every hospital has their own procedure. Every hospital they has their own protocol. So step by step, we should always follow. Breach in any of the step can lead to your exposure. Then after exposure, staff disposal is very important. As I have given example that the staff decided that I should finish my work and I should get one more patient medication, then get done, and then I will discard the rest over things. And by that time, in between that thing, the exposure happened. So immediately, staff disposal is very important. So in every hospital, we have needle puncture proof containers which are being kept. So whenever you are dealing with needle, it is our responsibility to discard as early as possible to that sharp container. And definitely not the least, the training part. So whenever there is an incident, you should always conduct a training. Pre and training also should be done with the pre and post that. And the training, you should always cover that staff that has been exposed to that injury, so that you can give an example that what went wrong and the effectiveness of the training can be clear. For example, the needle stick injury happened because improper segregation of the biomedical waste. So you should ask that staff that what went wrong and why, from where, how we can correct, so that other staff also get trained by them and they should not commit the same mistake which the staff has done. So like safety devices, I have talked like safety devices, most of the hospitals we are using the safety devices. So there should be frequent training related to the use of safety devices with the proper technique that how we have to use it. Because sometimes it happens that we are not able to use we have the best safety devices, but we don't know how to use it and we manipulate it and we get the injury. Again, protective gears. So as I told, gloves is a protective gear. It's just a barrier between you and the patient. If you are wearing your glove, the severity of injury can be less. It's not like if you are wearing gloves, the incident will not happen, but the severity of injury will be less. Second, as I told that procedure, as per procedure and protocol, you should always follow the safety checklist procedure protocols whenever you are dealing with any of the procedures. What is the healthcare responsibility in this? So whenever there is a incident happen, the responsibility lies into the healthcare. So healthcare worker must follow safety protocols, engineering devices, and properly dispose of staff to prevent the needle stick injuries. Right. So this is how you have to follow it, as I already told. And important is training and reporting, because training and reporting, as I told you, is that whenever you are reporting it, you are narrating an incident. So if you're narrating an incident, you are coming in cross with a proper RCA that what happened, and why did the incident happen. So to prevent that incident to happen in future again, there is a preventing action. So always the reporting is very important. So your responsibility is not to hide any incident, not to underreport it. It's always better you should report it, and you should get trained out of it. So your responsibility is also, like, if you're reporting, you are preventing. Yeah. So here also I have, like, prevent needless injuries is not only uh, one's responsibility, is everyone's responsibility. Then, as I told, most of the incidences happens related to the use of safety devices. So after being the safety devices should be used properly and correctly. And after the use, they should be properly disposed of immediately into the shops. So take home message for this prevention of needless injuries, like, all the everything is based on prevention, right? So there are risks, there are safeties. So if you want, you all the needle stick injuries are being prevented. So immediate action reduces risk of injury, and if you are using the safety devices, uh, that also will reduce your injury. So if you are reducing the needle stick injury, you are also having the responsibility of staff and organization, that you don't have to come for frequent follow-up. One follow-up, it requires three follow-ups. So ultimately, it's been charged. It's like hospital yes. So if you're preventing, you are preventing the expense also. Effective NSI prevention, like staff reduces costs also, improve the patient and quality also. Education also, and technology and policy which are you are being used, that is also been monitored. So this is the APINet form which we are using. In that, there is a brief discussion about the needle stick injury, that what went wrong, what was wrong, which device you have used. So all this information is given in this. So information part to be filled is very important, so as to check whether you have gone where you have gone where you have gone wrong. And apart from this is very important, which part of your body has been injured. Then there is also a column of financial rate, that whenever there is a follow-up, one follow-up, two follow-up, one number of testing is required. So this all details also is been given here. So for example, for one follow-up, it costs around 2,500 to 2,600. Like, if you, it depends upon the hospital to hospital policy. So if four times if you are going for a follow-up, so you can estimate your hospital cost also. So it's not only about the cost, it's about safety, right? So preventing one realistic injury can lead to the organization safety as well. Now coming to the staff exposure, which is related to tuberculosis. What is tuberculosis? TB. TB is an airborne infection or a droplet infection which is released by a patient with active pulmonary TB, not via surfaces. As I told that when we have during this time, I asked one of the consultant that we have a patient, should we isolate it? His answer was that TB is still in the environment, so how many patients will be isolating? So every hospital has its own facility management related to protocols, like we have negative pressure, we have positive pressure. Only thing is, like, we should know what is this airborne infection, and what are the protocols which we need to follow. So TB is one of the airborne infection which is caused by a patient with active pulmonary tuberculosis, right? So HAGS environment means how it is caused whenever there is a poor ventilation, prolonged close contact, or any aerosol procedure is been done in any of the patient, and we breach to follow the protocol, you can lead into tuberculosis. What are the preventive measures you need to follow? Like, you have to follow the strict infection control measures. Like, early detection is very important. At times it happens that patient is admitted only for a severe cough and cold, and he is having cough, but there is no test advice. Patient stays long for a week, and then the consultant advised that go for a sputum test, and then sputum test come to be positive. So as I told that prevention is very important. You know that patient has been admitted with cold and cough, so you should always be wearing mask. After detection of the TB, you should always uh, go with the preventive strategies. Like patient was already admitted with cold and cough, but when you came to know that his sputum is positive, so you should be having a double mask. You should be have N95 mask. Whenever you are using an N95 mask, you should always check for the fit test of the mask. You should go for the isolation precaution, whether you should isolate the patient for a single room or any negative pressure room is available. You should always isolate the room patient in that negative pressure isolation room. So airborne transmission means TB spread through airborne droplet nuclei produced by coughing, sneezing, and aerosol procedure. In the healthcare settings, it's likely like ER, ICU, which are been highly exposed. So they are open. We never know that which patient is carrying which infection. So as I told in the beginning, whenever you are entering into the hospital, you should treat everyone as a infectious only. It's not only about ki a patient is having TB, so I should wear a mask. If patient is having an HIV positive, so I should wear a gloves. So for TB, the engineering control is very important. That is ventilation, negative pressure room, HEPA filter validation, and system that reduce airborne contamination. So personal protective equipment, as I told that you can have a mask, but if not, then you should always go for an N95 mask. Whenever you are having an N95 mask, you should always go for a fit check. Apart from that, when you see that any patient who is coming in contact complains with cough and cold, so you should always, as a part of your health education, you should always uh, teach the patient about the cough and sneezing etiquette. Like you should always say that you can use a handkerchief after the sneezing. You should always go for hand rub and hair swab. You can use the use of this sleeve whenever you are coughing. You can use this short method whenever you are sneezing. So these are the small things which can prevent the spread of infection which are related to airborne. Then whenever any staff has been exposed, what action need to be taken? Like prompt exposure reporting. As I told that no incident should be kept hidden. It should always be notifying. You should always be reporting it. So whenever you identify yourself to be exposed, you should always inform your infection control nurse or the healthcare organization immediately for any detailed documentation. Then baseline symptoms for screening should be done. The staff should be screened for TB symptoms such as persistent cough, fever, or overnight cough after exposure. Initial follow-up and testing. Perform a tuberculin test or IGRA. IGRA is your gamma release acid test or the skin test. As per your hospital facility, what type of testing facility is there in your hospital. So repeat testing after 8 to 12 weeks if initial results are negative. After that, the most important thing is education is specialist consultation. Educate the staff on self-monitoring for symptoms and consult specialists for high-risk exposure and prophylactic therapy. Like we have respiratory physician, so you can consult a respiratory physician for better treatment regimen. Then category like immunology category, imaging testing, direct detection, and advanced tools are available. So as per your hospital facility, what all tests are being advised in your hospital, you can go as per the hospital testing facility. Like here we have a simple Montauk test. We can go for a simple Montauk test, and the best test can be an chest X-ray. So every hospital has a chest X-ray facility to detect an active TB. Apart from that, we have a sputum smear culture and gene expert. So based on your hospital facility, you should go. You should always be going for, before starting any regimen. You should always be going for this positive testing. So drug and dose of TB depends upon the resistant pattern of the this gene expert report. So advanced tool use the CT MRI also. So if you want to go for a detailed study for detection of the TB, you can go for CT MRI as described by your consulting consultant or physician. So baseline follow-up testing, that as I told, that for baseline, this tubercular skin test is advised for exposure, and it is been repeated after 8 to 12 weeks of identify infection. So evaluation of the symptoms is very important. Whenever you have been exposed, you should always do self-evaluation of your cough, your vitals, and any if any consultation is required, you should always go for consultation, radiographic symptom as per your whatever your these consultants are advising. Record keeping and education. Record keeping is very important because you are part of an organization. If you have been diagnosed with any of the tuberculosis, you need rest. So it's very important, as per your HR policy, you should be provided leave, and you are at a risk of infection you can spread. So you should always be confine yourself whenever you are having. So you should always confine yourself and stick visitors. So maintaining detail of staff exposure record and educating staff on infection control measures, compliance and support outbreak investigation is very important. So advanced monitoring of protocol. So like I told you that you can go for testing like emergency care analysis, emergency detect and TB transmission among healthcare workers. So there are advanced tests also which you can go for better result and early detection. So, as I told that you are a part of the organization and your safety is our responsibility. So, whenever there is a exposure related to TB, monitoring and duty restriction should be there as per your HR policy or as per your organizational policy. Aseptic staff with negative test continue work with monitoring. Symptom individual must be included pending evaluation. The staff who can work should be having a fitness certificate from the treating physician whether he can resume duty or not. So it totally depends upon your physician what he is allowing as per your test reports. So after the diagnostic clearance, whether TB is ruled out using test X-rays, sputum tests, or staff return to a patient care duty. So it depends upon the fitness clearance only. After that only you should join for duty. Return to work guideline, as I told, as per your hospital policy, every hospital has their own policy for infectious disease, this leaves and restriction. So clear return to work criteria balance infection control with work needs, required specialist clearance for TB resistant. And it is always a confidentiality. You should not be telling anybody that this staff has been exposed to TB. So you should not contact him. You should not do this. You should not this. It's totally a confidentiality. So the communication part should be very important. There should be a transparent communication and confidentiality that maintains the decorum, and it maintains the trust of the staff who is working with us. So it's depend on the hospital policy, what work you are doing, what are the restrictions you are following as per your hospital terms and policies. Administrative controls means if early triaging and isolation of coughing patient reduce the risk of exposure opportunity in healthcare setting. As I told that whenever you should treat every patient as an infectious. So every strategies like triaging is very important whenever any patient is coming in emergency or he indicates a previous history or a history of TB. So early triaging is very important. If you get the early triaging, the early precautions can be followed. Environmental strategies like negative pressure room, optimized ventilation, and HEPA filter validation should be regularly monitored for any deviation so that the environment of your unit is well maintained and there should not be any lefts, even though if there is isolation facility, but if it is not working, it is of no use. So regular maintenance and regular check is very important. Again, personal protective equipment, like if you've seen that the patient is having a TB, you should always go for an N95 mask, follow the barrier precaution, and you should always go for the fit test. And as I already told that you should always educate patient and yourself regarding this measure coughing measures. Like education compliance, as I already told that cough techniques, education, surgical mask for patient, and audit reinforcement for infection control compliance should be done. Comprehensive TB education, training over TB transmission risk. Now we have most of the yojnas also, which is government based. So they are also coming. You can be a part of that program also, and we can indulge. They get so many knowledge. There are patients who are not been not afford for treatment. They are getting that. So there are comprehensive TB education also, which covers the treatment regimen, symptoms, and awareness sessions also. PP and compliance. Practical section should be done for like fit check and respiratory use, that how you have to use it. So if you are wearing an N95 mask, but if you don't know how to use it, it is of no use. Then administrative controls and reporting is very important. So training emphasizes on isolation practice. Timely should be set. There should be separate staff who should be reporting for isolation. They should be trained regarding donning and doffing technique. It's very important because sometimes it happens the gas which you are using for your personal safety, if you are not using it properly, you are being infected. So whenever there is during the COVID time, we have this digitalization facility we have followed, like for training and everything. So rather than visiting again and again to patient, you should always report as or when required. So platforms to get exercises, supplement classroom training, enhances engagement activity you should do. Like previously it was written based training. Now everything is been digital, everything is been online. So you should train staff accordingly. So awareness of the healthcare is very important related to TB also. Surveillance and data analysis. So you should always do a surveillance of your system, check whether all the system in your organization is working properly or not. So environmental log list, as we know that as per the sixth edition, as per the surveillance is not required. But to facilitate ease, you should always go for system check. Collaborative feedbacks and look like you can do audit with all the engineering control measures. So more number of feedbacks, no more number of improvements you can see. So continuous improvement and feedback. So I like this plan, do, study, and act data analysis cycles, which we use is like you should always, whenever any thing is that you should always plan according to the plan. You should always act, and act after the act. You should always full study, and you should implement it. So this is the strategy. You can also follow it, like you can identify a problem, you can jot it down, what are the things, what are the lacunae, and you can work on it. And then after that, the most important thing is sustainability. So if you do that, it is a cycle based toolkit which gives a very good feedback. So it was all related to TB. So isolation and TB is like based on your precaution, you based on your protocols, based on your hospital facilities. So whenever you are seen any TB patient, or you should always be following your precaution. Precaution is like, it's not only precaution is wearing a mask, whenever you do whatever things you do to protect yourself from that patient is a protocol. So you should always follow that. Again, now the third is like we have infectious disease exposure when any individual is coming in contact with biological and that may lead to any of the exposure. Type of exposure, as I have told you, that it can be airborne, droplet, contact, or bloodborne pathogens. The indicator, as I know, like is contaminated with any of the things, that needle stick injury we have already exposed. So the next slide will be the repetition of the slide, but I will be focusing on mainly on the barrier nursing precaution, the negative and positive pressure, the donning and doffing part. So again, all the infectious disease is related whenever there is a breach in the protocol. Breach in the protocol means if you are not followed your hand hygiene, you have not followed the contact precaution, you have not followed the droplet precaution, you have not followed the respiratory precautions. So airborne transmission, droplet precaution, contact precaution, and bloodborne transmissions. So exposure risk includes, like I have already told, that whenever there is a breach, you can fall into any of the exposure risk. So this is all the repetition of the slide, like exposure risk depends upon your indicator contact and breach protocol. Like if you're not following any PPE, hand hygiene, it will lead to exposure. The most important thing which I have found is whenever there is a breach in protocol, whenever there is infection control, this 5 moments and 6 step is very important. As I told that everybody knows to wash their hands. They have learned there from childhood, but still being so experienced, we are talking about hand hygiene. So it's all about guidelines like we have 5 moments and 6 steps. The first moment, if you compile this first moment, like you can prevent the 90% of the infectious rate. Like first is before touching patient, whenever you are touching a patient, you should always go for hand rub or hand wash. Whenever your hands are visibly soiled, you should always go for hand wash. If your hands are not visibly soiled, you should go for hand rub. The second is before any clean or aseptic procedure. Third is after coming in contact with any of the body fluid exposure risk. This I have told you in the beginning because I love this. Whenever you are putting your life into risk, you are putting your life into risk. So it's very important that you should follow this hygiene practice. Fourth is after touching patient, and fifth is after touching patient surrounding. The WHO movement doesn't end here. They defined it. This is the moment how when you have to do the hand washing, but they also tell us that how to do the hand washing. Even though number of training has been happening, even though we undergo so many exposure, but still we fail to follow our 6 step. As I told in the beginning, that it's not about only when the ICN is coming, you have to follow the 6 step, or any senior leadership is coming, you have to follow the 6 step. It's something called as religious. You are doing it for yourself. So you should make sure that you should follow all the 6 step because you are doing it for yourself. So if we compile these 5 moments, I always remember this Bunty, which we always see in ad. He says that he has given us a tagline, which is "Dhote jao, dhote jao, dhote jao." So this tagline I like very much. So whenever you are in your field of work, you find yourself coming in contact with any of the body fluids. If your hands are visibly soiled, please go for hand wash. If your hands are not visibly soiled, you can always go for hand rub. So to educate and to create awareness among the staff, we can conduct different activities, like we have here Busy Rub box, in which every month we do, and we just check this with the help of UV rays. And recently we have updated one mobile app in which you can do the step by saying. So we have posters also. Now we have mobile app in which he allows us to do the step by step. So apart from that, every hospital we celebrate our hand hygiene day. So we can include, it's not only about 5th of May, or it's not about only global hand washing day. It should be every day, right? So we should be engaging consultant everybody in the hospital for this hand hygiene, because 90% of the infection rate can be cured by proper technique of hand washing. Next protocol, which can be related to the isolation. Isolation, we have two types of isolation. One is positive pressure isolation and one is negative pressure based isolation. Positive means the patient can get infected because he is an immunocompromised patient, like burn patient, immunocompromised patient, post-transplant patient, chemotherapy patient. Negative pressure means the from which we can get infection, like we have TB patient, chickenpox patient, or we have seen the COVID patient. For both the patient, we should always following the barrier nursing. Barrier nursing is nothing but the protocol and precaution which we follow to protect that patient, to protect ourselves, is called the barrier nursing. For example, if you have isolated a patient into a single room, it's not an isolation room. That's also a protocol of isolation. If you are doing hand hygiene to protect yourself from that patient, it's also a protocol. So this is how protocol based, like universal precautions, standard, contact, airborne, and respiratory. So here I have just highlighted donning and doffing, which is very important. Whenever you are putting on PP, you should always check for this point. First is choose the right and appropriate type of PPE for the task. Second is inspect PPE before use to ensure any proper fit, and follow donning sequencing. Right. So in the day-to-day also life, whenever we are going for any shopping, whenever we are going for buying our clothes, we check the best of the storeroom. Like my clothes, if I go, I will not get anywhere if I have to go to website only, because I know that in website only I can get my fitness dress. So this is how you should always choose the right type of PP if you are wearing. Second example can be my hand is very small, so it in my hands I only wear six size of glove. But if somebody is offering me seven number gloves, it is of no use. So proper selection of PP is very important. Before that, you should also check, like whenever we are going for buying gloves, we also check whether it is fit or not, whether I'm looking good or not in that PP. So you should conduct this while wearing your PP, while wearing PP in hospital also. So donning and doffing technique is very important. I hope everybody follows it. This is a CDC guideline which I have used. So they have a CDC, in the CDC guidelines, you have a sequence of donning and doffing. Sequence is very important because, for example, I have been called for a dinner and I have to eat like roti sabzi. So I cannot eat a sweet dish in the beginning. So it's how that the taste is also important for everything. Whatever sequence is given, you should follow that. If you are not following, again there will be a breach. After removing PP, you should always remember that there should be a minimum contact from the body when you are removing the PPE. Always remove the PPE from inner to out to avoid cross or self contamination. And after removing of the PPE, which is very important, your hand hygiene. So whenever you are removing the PPE, you should always go for hand rub or head wash.
Yeah, hi, Ms. Namita. Sorry to interrupt. So you have 12 more slides left, I guess so. So it's already 4:30. If you could take
I'll
us
go
through
for
with a quick glance in each slide, then we can focus on the Q&A sessions also. Thank you so much.
sure.
Yeah.
So after removing the PP, biomedical waste segregation is also important. So as per the waste segregation policy, the PP should also be discarded in the proper color code. So depending on the state policy, we have 4 color codes like red, yellow, blue, and white, which everybody is known. Red is for the infected plastic. Yellow is for the non-infected plastic. Blue is for the broken glasses and ampoules, and white is for sharp containers. So biomedical segregation plays a very important after the wearing of these all devices. So reporting and documentation, as I told, for every incident, for any exposure, the reporting and documentation is very important. So this baseline testing for all exposure, it depends upon what type of exposure is that, what type of incident you have undergone. So conducting risk assessment for every incident, you should always go for a risk assessment, like factors included what were the risks, vaccination of the staff, whether the staff was vaccinated or not. Assessment outcome is that whether the need any prophylaxis, whether whatever the staff required any tool for management, you should go for it. And important of standardization tool is also very important. So this is all the repetition of the slide which we have already tested, like tubercular testing for TB, bloodborne viruses testing and monitoring. For respiratory, you should go for respiratory markers, and documentation is very important. So post exposure, as I told, depending on the exposure, what type of exposure you have. So depending upon exposure, your post exposure regimen is required. And infection control measures, environmental isolation, it's all repetition. So I'll not go, I'll just skip. So baseline summary for today's is the early reporting and response is very important. Screening and testing protocols is very important. Infection control measures like PP, hand hygiene, environmental monitoring is very important. And for the staff education and staff safety, vaccination and education should be on continuous basis. So this is the only that's it. For summarizing the whole topic, you should also know about the risk factors. As I know what are the risks in your hospital, like understand the risk strategies, assess and prioritize. For every incident, you should always assess and prioritize the incidents related to the incident. Then apply standard precaution. As I told that every hospital has its own protocol to follow the precaution. Standing control like injury controls and administrative measures you should check. Response and effectiveness also you should check that whenever there is an exposure, you should be given importance and it should be immediately reported. The staff equipment and education is very important, and state preparedness is very important. That in the first slide I told that you never know when will the incident will happen to you, so you should always be prepared. You should always be geared up with all the safety gears. So to summarize, if you are in the institution, if you're low, it will if there is no exposure, you are lowering the medical expense, reducing the compensation of the claim that the staff has undergone. There will be less time of work, and sometimes there is a legal cost stability also, that also you can reduce it. To summarize that, we can also say that exposures are not only meant like needle stick injury or this. Every healthcare workers, it is a serious concern. Should take it seriously, because it hampers not only the cost, it's also your life, your risk, and that thing. So to end up, it's not only like exposes everybody's responsibility, it's everybody's responsibility. So you should not be stopping yourself to get better. So the take home, the references which I have taken is from the CDC, WHO, and NHSN. And thank you. The take-home message will be there, which I always give is for every staff, you should always, whenever you are coming to the duty, whenever you are coming to the hospital, you should always do the three things. You should never come empty stomach. That creates a gulch, and if you are empty stomach, you will be prone to get infection. You should hydrate yourself very well, because 8 to 6 hours duty you are doing. Most of the time you are standing. We just check the intake and output of the patient, but we fail to check our intake and output, and that can lead to any risk, right? So you should always hydrate yourself. And third, very important, that you should take your sleep properly. So if you are taking your sleep properly, you should not be deviating, you should not be semi-conscious, and you would be preventing infection. So the take-home message from my side will be like, stay safe, stay healthy, and stay protected. Thank you. I hope that session was fruitful and you have understood. If any question is there, I will be happy to take.
Yeah. So thank you so much. Thank you for taking this such an interactive session, and we had you have been sharing a lot of examples to make this session much more interesting for all our learners. So thank you so much. And also we have a few questions quickly. We can run through that, Ms. Namita. So I'm in the Q&A portal right now. So see, the first question is like, if the staff had an injury from a clean needle, which was pricked into an IV fluid bottle for air vent, is that also considered and must reported as a needle stick injury? So that's the first question.
Any injury, if it is related to the sharp injury, it is an injury, but depend upon the source of injury. Like the needle was fresh, so you cannot needle was fresh, so you can avoid the viral markers, but you can apply the preventive strategy. Like needle has been pricked, right? So the severity of, according to the severity of needle, whether it was a hollow bore needle or whether it was a small needle or whether it was a which type of needle, the severity of injury will define you the further regimen. So if you are having an incident related which is not exposed to body fluid, but still it is an incident because you have pricked yourself, you have harmed yourself. So I think it should be reported, not as a part of your needle stick injury, but as a part of your preventive and training purpose.
Yeah. So perfect. So then the second question is like, from Kawaljeet. So what type of precaution required in multi-drug resistant organism found in urine culture, blood culture, ET, or the sputum culture?
Okay. It's always like a contact precaution, depending upon the type of contact, like for what type of organism is that. Like for a urine culture is there, so whenever you are coming in contact of that person urine, you should always wear a gloves. Sputum culture is that, so we have disposables also. You can offer that disposable. You can offer the staff or the patient mask whenever he is spitting. You should ask if he is using the wash basin, you can always ask him to flush whenever he is going for sputum spitting and all. So this bloodborne ET and sputum, it only requires a sensitivity report. Based on your sensitivity report, you can go for contact precaution. Contact means if respiratory precaution mask is required, you can wear a mask. If gloves is required, you can wear a gloves. If any procedure is related procedure is there, so you can go according to the procedure related.
Yes, yes. So that was clear. So,
And for multi-drug organism, most important thing is hand hygiene. So, you are drawing blood, patient is there. So, more for everything, you need to have your hand washing or hand hygiene is very important.
okay. So then another question is like, do we need to use soap while
Mm.
washing the injured area or just water will do?
A normal water can.
Yeah. But I think if I would also can add the points,
So you
no,
can
Ms.
wash,
Namita.
you can wash that under running water. If any contamination is there, it can be removed through water. Soap can be an irritable thing, so you can avoid, or but you can use. There is no harm in using a soap also.
Yes, yes, yes. So to add on to Ms. Namita's point, no, using soap, as she have said, like it will not harm anything. But one thing is like it will not kill any HBV or HCV what you have got infected. So it is just to remove the the surface contamination. So that's the point you have to understand when you use soap. So because most of the healthcare workers are getting confused. If we use the soap, we entirely wash off the infection. So that's the thing I want to have a clarity here. And yeah. Another question, like post-exposure, how many times to be done serology to the affected employee?
Post-exposure is based, as I told, is based upon your NICO guideline, is based upon your hospital policy. Few of the hospital, they do it on 0 day, third month, and 6 months. Few of the hospital, they do it on 0 days, 6 weeks, 3 months, and 6 months. So it totally depends upon your hospital policy, what regiment you are
Okay,
following
okay.
it.
So then, yeah, I think you have clearly mentioned during your presentation also. It is also depending
Yes.
on the institutional policy. You were right. And there's another question. I don't know why this question is like, is hepatitis C vaccine available at present?
Hepatitis B vaccine, I don't think is available. Only you have hepatitis B vaccine.
Yes. Um,
For hepatitis B,
and
only you have to follow contact precautions.
And there is another question from like Ms. Divya Joseph. Like, even though recapping is taught and hands-on training is given, still it is followed. Like, any suggestions for it?
This I have presented in my like my presentation where I have gone for an NABS. This question was there. So for easy thing, like I told that there is a practice. It is a habit of recapping it needle. So you need to develop a practice of one scoop method. But sometimes it is not there. It's about practice. But what you can do, you can have some holders which from which you can recap the needle. So if you are not able to recap, you even if you are habit in a habit of recapping it needle, you should not directly recap it with your hand. You can use needle holders, or you can use pluckers to recap that needle. But it is strictly prohibited that you should not recap the needle. But if, for instance, if you want, you can have that device which is like a holder type.
Yeah, yeah, you're right. Another thing, if also no, they can carry a small mini needle dispenser, like where they can discard
Yeah.
immediately, so that they
Yes.
don't have
Yes.
to do that until they come to the nurse's station. They don't have to carry such needles in that.
Such things. Yeah.
And I think a few more questions added here. So, any legal liabilities on hospital for infected needle stick injury?
Infected needle stick injury, as of now, I have not this. But for example, if source turn to be positive and the staff turn to be positive, as I told that we can only give 6 months regimen, but follow up treatment regimen will be taken care of by the staff itself. So it depends upon your hospital policy. What as per the HR policy, we have some medical claim facility also. So whether that is covered in that part or not. So any incident which is reported during the hospital work period, it is bear by hospital expense only. So it depends, totally depend upon your hospital policy, what regimen you are following.
Okay, there's another question. According to NABH and new guidelines, what are the changes in BNW management? Is that so?
There is not much changes related, like in the 2016 and 2019 guidelines. Only one thing was that related to the use of cardboard boxes, which few of the hospital has used and few of the hospital have not. And one time it was like related to the barcode system facility. So as per most of the hospital, we are following the 2016 and 2019 guideline. Apart from that, there is a state policy, like we have here in MP, we are following the MP state pollution control board policy. So whatever they are, we have our agreement from our hospital, so we are following that. So it depends, clearly depend upon the state in which you are staying. So as per the state regulatory norms, you should follow the biomedical waste management policy.
Okay, so we have done with the Q&A portal. So let me get into the chat box. There were a few questions. Let me go from the bottom. Okay, ma'am, during NSA, if used, like hand wash by soap will give pressure over injured area. What can be done?
In my slide, I have told you three things. You should not squeeze. You should not be panic. You should not squeeze. You should not suck. So if you're rubbing, if you're squeezing, there are small capillaries which can get burst, and the severity of injury can be more. So it's better you should only wash with running water till the time the blood is coming out, and you should immediately report to ER for your first aid.
So there is another question in no puncture-proof container. Can we dispose the needle with the cap?
No, as I told you, it's not. It's only related to your state policy. Like here, we have to. In the MP state, we have to cut the hub of the needle. So it totally depends upon your hospital policy, what agreement he has done with your external local authority. So if there is a agreement of disposing of needle with the cap, you can go ahead with that. If they are using, like here, we are cutting the hub of the needle and then we are discarding it. So it totally depends upon your hospital policy, what agreement they have done with your local authority, biomedical waste license policy.
Yeah, perfectly you have given the answer. It's just a certain things are like based on the state, state protocol and all those things. So then another question, like unknown case needle prick, what to do? Like if they have not done any viral markers.
As I told that everything you should treat as an infectious thing. So as per the NICO guidelines, if you think that the source is unknown, and for example, for any word, you can search for any positive cases. If it is not there, if you're not able to find out, it totally depends upon your ID consultant what therapy is advising you. So if he is asking you to go for a regimen, you should go for a regimen. If he is saying that no regimen is required, you can go with no regimen also.
Yeah. And one last question, what is the full form for IGRA?
IGRA is Infection Control Risk Assessment Strategy.
They're asking for IGRA. I think I've mentioned in your presentation. So
IGRA is your interferon gamma release assay. It is a tuberculin test like we do for TB test. It is a skin test. It is type of skin test.
Yeah. So I think especially this is done for the healthcare professionals who are at higher risk. Like, am I right? Like,
yes.
So
yes.
ensure their all the healthcare professionals are in the safer hand in order to prevent them. So during the recruitment also they used to do. In most of the organization, they have that as a SOP, like to analyze whether the staff who are joining the healthcare organization also is free from such contaminant infections.
It's a type of blood test which you use to detect tuberculosis. Like we
Yes.
go for one test. It's an advanced test which you take it from blood.
Yes, it's a blood test. Yes, yes.
It's a blood test.
So thank you, Dr. Preeti Chaudhary. I've brought it up here in the chat box. Yes, of course, she have told that like it's a blood test. It's not a skin test. And thank you so much to all the participants. It was a very informative session. So then, it got a lot of informations to share it with you all regarding this. Cannot be bound within 1 hour 30 minutes, but our speaker have did amazing job to complete it within just a 5 minutes. I've got extended, but I thank all the participants who have stayed throughout the session, supporting this webinar. And thank you so much. And sorry, we have delayed your timing, with your schedule. Sorry for that. And we'll keep up with the timing and the next things. But totally, I agree with Ms. Namita. Your sessions were purely excellent. And all the examples what you have given, I think it will be useful for all the learners. Thank you so much. And thank you to all the participants. So what I'll do is meanwhile you all are leaving, Namita, I just request you to stop sharing so that I could bring up my screen. So yeah, thank you. So what we will do is I'll bring up my screen here. So while you're leaving, you can, as I have mentioned earlier, so we have this quality masterclass upcoming next week. If anybody is willing to register for this program, as I've informed already, undoubtedly after this program, it's going to be a great turning point for you in the administrative work. So you will have a lot of transition in your auditing thing, you will become a surveyor, of course, so all these things will be taught in here by this speaker who's is going to coming up with the a complete to make us understand how the protocol works during the auditing things. So I'll keep this display here for you all to register for this program. It's a paid masterclass. You can click onto this and you can register for this program. Who all are willing, all the participants are here, grab this opportunity. And thank you so much, Ms. Namita, once again. It's a very valuable session and we are glad to have you here, and great.
Thank you, Stella, for the opportunity.
Thank you. So you're okay to leave the Zoom room. So we'll stay here for a while and then we will.
Thank you, everyone.
Thank you. Thank you so much. Yeah. So all the participants who are willing to register, you can register. You can scan this QR code and register for this program. All of the participants, the session is over. We are here, for the benefit of the participants who wanted to get to know more about our course and details. So thank you so much. Yeah, there is also a link is provided in the chat box. Who all have a problem in scanning this QR code and register for this program, you can click that Razorpay link and you can register yourself. And also out of this, it's cost of $7.99. Out of this program, you're going to get the handout resources, which is going to be a straightaway implementation tool for you all.